30,000, such a big leap from very few dental colleges to 300, and huge number of BDS, that is Bachelor of Dental Surgery graduates are passing. They were telling me that for their exams in the dental college, they only have to bring the patient. So in fact, they have to pay some commission agent. You pay him 10,000, he will bring a patient for you. So there are so many conditions a dental doctor can diagnose by just looking at your mouth. But the WHO says that for 7,500 people, we need one dental surgeon. So India went on producing dentists. They don't go to rural area, and it is because the cost of the equipments are very high, and you know dental education is not very cheap, so they have to spend around 40 lakhs. 3.5 billion people, that means half the population of the world is having some or other oral health problem. Now the problem is we consider dentistry only for aesthetics. Hello and welcome to another insightful episode of MIO Podcast. I am your host, Dr. Suresh Rao. I am Director of Mangalore Institute of Oncology and a cancer specialist. In our MIO Podcast, we discuss health issues or any issue that impacts our life and society as a whole. Today we are coming up with another interesting topic. So this is very interesting because we wait till the pain becomes unbearable, only then we consult. As all of you know, this is oral health, that is dental problems. So we will discuss the issue about oral health and how much importance we give it to it, and actually how important it is. So we will discuss all this in today's MIO podcast about oral health and the role of our colleagues, the dental surgeons. Generally, let us understand the education and status about the profession. Like see, when I was studying, that is I am talking long, 35 years back. So I did my MD in 1989-90, so about 35 years back. At that time, after MBBS, I wanted to do MD or MS. So all of us, want to do post-graduation. So at that time, my dental friends who finished BDS, they also will do what is known as MDS, Master in Dental Surgery. At that time, any branch of dentistry, post-graduation, was very prestigious and very difficult to get. And my colleagues in the dental field, after their post-graduation, they used to get very good job, and their profession was actually on the top at that time. Much more than what you say MS or MD or whatever we do post MBBS. So this was, I am telling, 30 years back. So it was a very, very prestigious course. And then what has happened down the line, around now 35 years. So now we have around 300 dental colleges. So every dental college produces 100 dentists. So around 30,000 dentists are produced each year. So 100 in each college and 300 are there. Private colleges, few government colleges, but mostly private colleges. So 30,000, such a big leap from very few dental colleges to 300, and huge number of BDS, that is Bachelor of Dental Surgery graduates are passing. So there is a stark contrast between what was there 30 years back and today. Now the problem is when you expand like that, from very small quantity to so big number. So we should look at what is the job prospects, what is the quality of education that we are providing. So mostly what has happened is in our country, when we start a college, whether it is medical, dental, we more see on inputs, that is not on the outcome. We see what is the size of the room, how many dental chairs you have, how many faculty you have, and whether there is playground. There are so many other things which the Dental Council of India will see before giving permission to dental college. They never see whether the dental doctor has acquired skill, how many extractions he has done, or how many dentures he has done. In the prosthetic section, what work he has done. So we are never seeing outcome. Mostly we are seeing only the size of the building, all these which are actually not very relevant to the skill of the doctor. It is same happening even in MBBS. So we are mostly looking at infrastructure, all these things which never have any contribution generally to the skill of a doctor. So now we have 30,000 each year, and unfortunately the skill is not great because my friends are the dental doctors, and now I have in my hospital, in MIO hospital, many dental doctors are working with us in the cancer hospital. So they are all very bright, very intelligent. So they were telling me that for their exams in the dental college, they only have to bring the patient. So in fact they have to pay some commission agent. You pay him 10,000, he will bring a patient for you. So for your exam you have to bring a patient. So that is a pathetic situation on the clinical material. So how do you expect the dental surgeon to be well versed with all the fields of his knowledge, to get good knowledge? Because he has to work, he has to see hundreds of patients, then only he will be able to gain the skill and knowledge, whether it is dental or whether it is MBBS, it is the same, or maybe in any other field. So now the problem is there are too many dental doctors passing out, and then these graduates, unfortunately many of the colleges, they are not well trained, well skilled. See, recently I will tell you, 2 weeks back there was a patient, she had a tongue cancer. She was telling me she went repeatedly to a dental doctor, and unfortunately he could not diagnose that it was a tongue cancer. Then she went to an oral surgeon, another dental surgeon who is a postgraduate, and then he diagnosed it immediately. So these are all probably examples of where the doctor would have never seen a oral cancer. So if you see a small ulcer, you will not suspect cancer unless you have seen it in your undergraduate when you are studying. So when you see that, you will remember, oh, this is an ulcer, this could be cancer. So unfortunately, if you don't have enough patients and you are not trained well, post the degree you will miss certain things and it will be catastrophic for society. So that particular patient, instead of stage 1, it became stage 3 actually. So and it's a very advanced disease. So this is the problem, and WHO says that for 7,500 people we need one dental surgeon. So India went on producing dentists. We have 1.4 billion population, we require. So that's not the point actually. It is not just giving BDS certificates. You need to see what they are going to do after their BDS. So simultaneously you have to see everything. What is their job prospects? What are the number of dental people who are practicing in rural area, in the urban area. So there is a great mismatch. So 70 to 80% of our dental doctors, they practice in the city, because you have to put expensive dental chairs and so many things you have to do. So it may not work out in a rural area, and unfortunately 70% of our population lives in rural area. So there is a mismatch. Most of the dental doctors are in the city, whereas population mostly is in rural area. So these are the issue. Although WHO says that we need one dental surgeon for 7,500 people, you can't just make there so many dentists and all are in the city, because unfortunately they cannot invest big money in a private clinic in a village, because it is not going to work out, because they have to take money from the bank. All these aspects we have to see before giving the degree and producing so many dental surgeons, because they are all brilliant people, very young people, very intelligent people. So if you make them a dental surgeon and see if they are out of job or if they don't have a job, so a young mind is being wasted. You are teaching them for 4.5 5 years, and at the end of it they don't get a job. This is very unfortunate. And dental education is not very cheap, so they have to spend around 40 lakhs to complete a BDS and around 25-35 lakhs to spend on MDS. So after BDS you spend 40 lakhs, and if you don't get a job, that's not good. So we have to think So we should have empathy. We should just making dentists. That's not the end of it. So we have to find a complete solution before we start a course. So suppose a dental doctor is there. If his son study dentistry, or a doctor's son who is having a private clinic study dentistry, it's okay because he will have a ready-made clinic, then he can practice. But it's not so for 99% of the dental doctors. They are in turmoil actually, and we should be empathetic to them. We should understand what is happening. Now, let us discuss a little bit about oral health problems. Remember that oral diseases are among the most common problem in the world. 3.5 billion people, that means half the population of the world, is having some or other oral health problem. You see, such an enormous problem, and we are telling that our dental doctors are not unable to find patients or treat patients or look after somebody's oral health. So this shows the ignorance or lack of awareness, or maybe careless attitude of ours, of the public, regarding oral health. There's very interesting. One patient came the other day with a daughter who is 24 years. So the mother was telling the patient that we are trying to look for a boy. So then I asked her, what is the difficulty? Why are you not finding a boy? She said, sir, in our place, most of them have very bad tooth, very bad oral hygiene. I find it very uncomfortable to go with get married to a person with teeth which are full of stain and all bad hygiene. So it's so important, oral hygiene. And basically our film stars and those who are in the media should give a lot of importance to oral health. So whether it is film stars or cricketers, but unfortunately we don't see much of that. So oral health is not a priority in our country. So unless there is pain, and even if there is pain, dental pain, we try all some local remedy, you do all kinds of things, and when the pain is unbearable, you run to the dentist, because dental pain is very severe. It's like almost like a kidney stone or pregnancy related pain. It's quite severe, you can't bear it. So when that situation comes, we go to the dental doctor and do extraction or remove the tooth and all. There are so many other things probably he can do. So now oral health problems are huge actually. So unfortunately we think that oral health means decayed tooth, bad gums. We restrict ourselves to tooth pain is equivalent to oral health. Unfortunately that is not the case. Oral health has a big dimension. You should know, any doctor, when a patient comes to him, the first thing he said, open your mouth, put your tongue out. Why does he say that? The oral cavity will give you so much information, not just about the tooth and whether there is caries or whether there is cavity. Of course, that is also a big problem where there is a cavity, caries, gum hypertrophy. But you should remember that there is a systemic effect on oral health. The dental doctors will know, but there is something called systemic effect of oral health. I will tell you certain things about that. So now, when the dental doctor sees the oral cavity, he can diagnose if the patient has diabetes. So when you get repeated periodontal disease, recurrent infections, that is a symptom of diabetes. That is, if you have diabetes, you tend to get more periodontal infection. At the same time, you can get xerostomia, that is dry mouth. When you get dry mouth, again that is a sign of diabetes. Then candida, fungal infection will happen in the tongue. So a person has diabetes, you can see that in the tongue. And delayed wound healing also, you do extraction, if it does not heal, that is a symptoms of underlying diabetes. So patient has diabetes, you can do blood sugar and see, but the dental doctor can tell when you are going for oral examination. Similarly, cardiac diseases. So congenital heart disease, rheumatic heart disease, sometimes the lips become blue. So that is the way that you are having underlying heart problem. And similarly, medication what we use for heart, like antihypertensive, anticoagulants, these are all can cause problem in the tongue. So these are all important. like sometimes they use for hypertension diuretics, tablets which your urine flow becomes increased. So in that you can get dry tongue or what you call xerostomia. So with the tablet like nifedipine, you can get what you know as gingival hypertrophy. The gum becomes red and becomes big. So all this a dental doctor can tell by seeing. So diabetes you can find out, hypertension and cardiac problems you can find out, and measles, viral infections. There is what is known as Koplik spots. The dental doctors will know, bluish small spots on the buccal mucosa. That can be seen. And then other systemic conditions, anemia, whether hemoglobin is low. So you can see that paleness in the oral cavity. Blood cancer, you can get gum hypertrophy, you can gum bleed. And HIV AIDS, you can get candida, you can get other infections. Kidney disease also you can get what is known as uremic stomatitis and ammonia kind of smell in the breath. All these are very important, and even in liver disease, if there is jaundice, you can see in the mucosa, in the oral cavity. And most important is nutritional deficiencies, which is very common in India. So if you see B complex deficiency, you can get angular cheilitis or glossitis, tongue becomes red and inflamed. So actually he has vitamin B complex deficiency. So in India it's common vitamin deficiency, and vitamin C deficiency, in that you can get bleeding gums and poor healing. So there are so many conditions a dental doctor can diagnose by just looking at your mouth, whether it is diabetes, whether what medication you are taking, whether there is any measles, anemia, then kidney disease, nutritional deficiency. So it's very important that so many diseases you can find out the status in the oral cavity. So oral health is so important. Unfortunately, all of us are not aware of many of the things, so we don't give importance to oral health. So now we can go to what is known as, we'll discuss about public knowledge. So public knowledge is very much poor about oral health, and this is because most of us try to postpone dental problem. And one of the most important thing in oral cavity, apart from caries, cavity, then your other problems like getting toothache, decay and all that, is oral cancers. So in India is the capital of oral cancers in many states because of oral consumption of tobacco, either in the form of gutka or in smoking, alcohol, all that will cause oral cancer, and oral cancer is very common. So a dental doctor will easily diagnose oral cancers. So it's such a major thing, and if you diagnosed in first stage, you can get cured. Almost 100% all oral cancers can be cured if you are diagnosed in first stage. Now the problem is we consider dentistry only for aesthetics. We feel that only to make your smile beautiful or look good, or the teeth to alignment. So we put it as only on an aesthetic scale. So aesthetics is one important part to present yourself, to get confidence. There are so many things, but apart from that there are so many other things in dentistry, but we should not restrict it only to aesthetic part of it. Aesthetic dentistry only one component. So now the dentistry is advanced so much, it's digital dentistry, it's called 3D printing, you name it, and dentistry is advanced in a big way. So we have to be aware of it. And as you say, if 3.5 billion people in the world are having oral health problems, almost 50% of the population, so in India it is a big problem. So all the dentists should be actually taking such a big responsibility, but unfortunately because of lack of public knowledge, lack of awareness, lack of urgency, and that's why we don't give importance to it, and hence dental doctors are finding difficult to take care of the oral health of the country. So, and then we can go into some what the government is doing. So you can also see the government also hardly has any role in oral health. Some Karnataka government is, I think, maybe having some program on oral health, but by and large oral health is on the least priority of the government. There is no insurance. So it is we give so low priority. So the government can employ dental doctors in public schools. Schools, children's oral health is so important. They can find nutritional deficiency. They don't give importance to oral health in schools. Brushing the teeth twice a day, how to do it. And we need actually for each taluka few schools, maybe 10 schools, you need one dental surgeon appointed, and he should check the oral health of all the children, so that they will know the value of it, importance of it, all this they will know. So the government has to do a lot of work. So it is unless the government gets involved and give importance to a branch which is so important, there is no point in producing 30,000 dentists every year, which are doing even today, and then keeping them out of job. So that is not fair. And when there is so much actually to be done, so the government should focus mainly on basic things like oral health, primary health, nutrition. Nobody expects the government to do big things. So that is not expected from the government actually. That the people will do. Building big buildings, all that will be done by some other people. The government has to focus on children's nutrition, children's oral health. Just do that, and primary health. It's a very important thing. So we have to also know why these dental doctors don't go to rural area. Now we told you that 80% of our dental doctors are only in city. They don't go to rural area, and it is because the cost of the equipments are very high. So they have to invest at least 20 lakhs to start a dental clinic, based on of course the technology that they use, but minimum 20 lakhs they have to use. And if there are nobody to come to their clinic to take care of their oral health, the doctor will have to close down his clinic. So that is the problem, because investing money and starting a practice in rural area is very difficult. Actually, the dental pay, my friends or my very junior colleagues, actually, I have a lot of empathy and understanding about them, because they have studied. They paid 40 lakhs and studied, and they tell me in big cities they are paid like something like 7,000 rupees a month, and if they go far away to rural area, if there is a busy practitioner, he will give 12 to 15,000. So it's unbelievable that you graduate, BDS 4.5, 5 years, then you pay 35-40 lakhs and somebody is paying you 7,000-8,000. So it's very unfortunate, and I feel that all of us are responsible for this, and we cannot leave our children, young children who are just 23, 24, highly educated, just like that to do other professions. Many dental doctors do hospital administration, they do work in some IT company. It's unbelievable. In Western society, you don't get dental doctors. You go to US, you go to Australia, it's almost impossible to go get a dental appointment. They are paid very highly because of course maybe the awareness is higher there, and people give value to aesthetics also more. Apart from oral hygiene, oral health is maybe more priority in the Western country, and when they produce, we can say, or when dental surgeons or medical surgeons graduate in some of the Western societies, they see the requirement, they see how much job they get. They never see that somebody is you graduate and don't get jobs. They just immediately do a course correction. So what we have to do? So how many doctors are required? How many are employed? Accordingly, you see that the number of seats are there and all that, because it is unfortunate if somebody studies and don't get a job. It's a very sad feeling. So also as an oncologist, oncodentistry is another very big field. So cancer and dentistry, we go hand in hand in head and neck cancer, that is oral cavity cancers. So all our patients in MIO, in Pampel, Mangalore Institute of Oncology, every patient undergo dental analysis, dental health checkup before undergoing radiation or chemotherapy. So because the radiation and chemo, even radiation or chemo separately also damages oral health, because it produces xerostomia, it damages the gum, so the enamel is lost, you get caries, you get attrition, all this happens. So every patient we should take good care of the dental health before we start radiation, before we start chemotherapy. It's very important. Sometimes we ourselves don't take it very seriously. We say we have to cure the cancer, let dental be okay, but that's not the way. Actually, it will be very unfair later for the patient. If once he is cured of cancer, if he loses all his tooth, he can't eat. So we have seen that. So we should give, all oncology centers should give very much importance to dental treatment. So most patients have diabetic, hypertension, and then you are giving chemotherapy. Many times you give radiation and chemo together for head and neck cancer. So dentistry is a very important topic, and we should give a lot of importance. All cancer hospitals should take it up very seriously. So sometimes we take very less, give less importance to the dental problems of an oncology patient, and not only looking at caries and other things in the oral cavity. Also we have oral surgeons requirement, we have prosthetics, because when you operate sometimes some part of the palate is removed, so we have to make a artificial prosthesis. So many, almost all branch of dentistry, whether it's oral medicine, whether it's periodontics, whether it is oral surgeon, whether it is orthodontics, all these prosthodontics, all are having a role in head and neck cancer along with the oncologist. So they are part of a team. So it's very important that dental doctors should be involved in oncology of head and neck, and with their digital dentistry now, they can probably make such good dentures or prostheses, because most of them are ill-fitting many a times, and that can cause a recurrence of cancer. So all these are very important that we need to look for about it. Now what can we do? Only thing is, going forward, the government and the people have to give a lot of importance to oral health. If not for thinking about these dental doctors, at least for their own health. Oral health is very important, so we should not ignore it. The government should really get involved in a big way, especially in schools, government schools, private schools. All they have to tell that a dental doctor visit is a mandatory. Every month one dental doctor should see these children. So you have to train them, you have to teach them. So if you teach them when they are small, maybe from 5th up to 5th standard or 7th standard, once they are an adult, they know what is the value of dental and oral health. So I think this is a very interesting topic and very important topic, and it is affecting so many young people. Plus it affects oral health of half the population of India. That means 700 to 800 million people are affected by bad oral health in different forms and different degrees. So we discuss this topic only because I see my dental doctors who are very intelligent people, very good people, and they can do so much work, but unfortunately their opportunities are curtailed to very small section of society where they can't work. They are not paid well at all. 7,000 I told you, or up to 15,000. It's very unfair, and we have to look into this matter. The government, everybody who are thinking citizens and who have concern for others should decide what is the future of dental doctors in India, plus the oral health of the Indian nation. Thank you, and we will come up with some other topic shortly, and hopefully an interesting topic. Thank you.